Okay, so today is May 3rd. I'm speaking with Christine. I should probably introduce myself again. I'm Kerri Nevin, and I've been in private practice with my husband, Dr. Paul Nevin, for over 25 years now. Yes, I know.
Time flies.
It totally does. And we met in graduate school a long time ago. So what I'd like to do first, so I reached out on the Facebook groups just to see if anybody was interested in talking about their experiences with therapy. So we're not going to necessarily be talking about anything personal to you or like any issues or whatnot. But I thought it would be good to, just because May is Mental Health Awareness Month. So I thought it might be a good idea to just ask people about their perspectives on therapy. And I'll just, ask questions as we go along here. So given that it is Mental Health Awareness Month, I was hoping, Christine, that you could share with me just where were you at in terms of when you were looking for a therapist? Did you have any ideas about what therapy would be before you ever started?
I had never thought about it. I didn't have any issues growing up that I thought it wasn't even something that ever entered my mind. And then I had two significant life events that happened right around the same time I was an adult. I was married, and I had what I believe was like a nervous breakdown. So I had these things all going on, and my husband took me to my doctor, and my doctor said, "I think you need to go talk to somebody." And I was, at that point, I was like, well, I'll do whatever, I need to do to get better. So he gave me the name of a psychiatrist to go talk to. And I went to that psychiatrist. And I went to him for quite a while. And then I didn't go to him anymore because I didn't, from my understanding, I didn't have like clinical depression. I had more of a situational, it was all based upon a specific set of circumstances. So I stopped going to him and I did well for many years. And then I had another life event and I went back to the same psychiatrist and had treatment from him again because I felt so much better after I went the first time.
Oh, I see. Okay. And for that treatment, so you saw a psychiatrist and so he did medication management for you. So were you on medication at that point?
Well, I was on not an antidepressant, but he put me on Xanax because I was having panic attacks. So I was on Xanax and carefully monitored, and I, took it exactly as prescribed and everything. But it was more the therapy, the individual therapy.
It was more individual therapy.
Yes. So I had the second time I went to him, though, he did put me on an antidepressant. But I was having physical symptoms too. And the antidepressant he put me on seemed to help the physical symptoms.
Would you say that it also helped with the emotional symptoms?
Yes.
It was twofold for you.
Yes. Because I remember a couple years, maybe a year or two after I stopped going to see him that second time, I tried to get off the medication and I was all over the place. And I knew that I wasn't going to be able to deal at that time without being on the medication. It kind of just set me on the right path and I could think of things clearly and I could handle everything. It made a big difference. So, and I'm still on it.
Yeah.
I still take that medication.
And so you feel like that serves you and helps keep you sort of in alignment with yourself.
Yes.
So that you can deal with all the other things that come up in your life.
Yes. Yeah. And since I went to therapy, I have advocated for that many times with people that I've just talked to over the years. I'm 55. I've come across a lot of people who are going through a lot of life things. And anytime I'm talking to them, if it's a good friend of mine, I say, you should go talk to somebody because it makes a big difference. Sometimes you just are having the therapy session. Sometimes it's a combo of that and medication, sometimes just medication. And some people are fine, and I get various answers.
From different people.
Yes.
Well,
yes.
And is it always, it sounds like you had a very successful experience sort of like right out of the gate.
Well, I went in there and I didn't know what to expect, like you mentioned. I think I sort of felt like I was going to be in an interview, like I was getting interviewed for something, and like, how do you start out? Because this person doesn't know you at all. And the first therapy session I had, I cried for 45 minutes. That's all I did. I didn't even talk. I opened my mouth to say something. He said, "So what's going on?" And the floodgates opened, and I cried and cried and cried. And then he said, I'll see you next Tuesday, and off I went. And that was the first session. And then the second one, I was finally able to start talking. And it was, so I did, I just lost my train of thought because I'm old.
No, not at all. Not at all. Well, so what would you say, how has therapy helped improve your life?
Well, the psychiatrist I went to gave me very specific things to do each therapy session. Like, by next time I want you to do, it was sort of like I was frozen. Like I didn't know what to do. So I couldn't do anything. Right. So he would say, I want you to do this and this and this. Mm-hmm. And I would go and do this and this and this. And then I'd come back and he'd be like, well, how do you feel? Okay, I feel better. Now I want you to do this and this and this. So for me, it was more task related. And it helped me. A couple things I can think of that I give examples to people talking about it. I had a hard time with people saying like negative things to me. And I wouldn't know like how to respond because I'd be taken aback that they'd say something like that because I don't say things like that. And he gave me a very specific phrase to say that was not rude, but basically shut people up. And I remember that very well, that very specific thing he told me to say, and I've used it and it works. So that was successful. It was giving me things to do, very specific things to do to get me out of like what I thought was a paralysis. Mm. And the other thing was I was very confused about how I was going to get better. I didn't understand because I think people think with mental health, it's somehow different than everything else in your body because you have to use your brain and that's what's affected. Mm-hmm. And I couldn't figure out how I was going to get better or how I would ever get off medication that I was on. Like, how was that ever going to happen? Like I was going to be in therapy forever, taking medication forever or whatever it was. I didn't get it at all. And he explained what it is. And since then I've told people your brain can get messed up just like any other part of your body. The unfortunate thing is that we, I think society says, oh, if you have something wrong with your brain, oh, you're nutso. Like psychologically wrong, like you have, trouble handling issues or you're
flawed,
or you're flawed. Right. Like but if somebody says, oh, I have a heart condition, we're like, oh, that's too bad. You take medication and you go to the doctor and it's all okay, but it's not okay if it has something to do with your brain.
Which is such a difficult double bind to be in. There's like nowhere to really go with that. And so what helped you transcend that? Because clearly you have.
Well, he explained to me that very simple thing is there's something wrong with the chemicals in my brain. And sometimes different things can bring it on because you use your brain and your mind to think of things. So, that just him explaining that to me, I'm very like, you explain something to me and if it makes sense, then I'm all good with it.
Right.
And I also put as much into it as I could.
So you were very invested.
I was like, I want to get better. I want to know what's going on with me. I want to be able to handle situations that come along in life. And I don't feel like I'm equipped to do that right now. So what do I do? So when I went in there, I talked.
Right.
I did all the talking. I did what he said to do. I tried things. I didn't just go there and say, oh, everything's fine, because it wasn't fine.
It wasn't fine. And so were any of the suggestions uncomfortable for you?
Yes.
Definitively so.
Yes.
And what would you tell somebody else who was feeling uncomfortable with maybe the suggestions they were getting? I mean, the reason I'm asking this is when people talk to me about being uncomfortable with any of the suggestions that I offer, I tell them that they're probably doing it right. Because if you're uncomfortable, you're being challenged. Now, you don't want to be challenged to the point of immobility, But if you're just, it's sort of like when you go to the gym. If you pick up a weight and it's like, oh, that's really hard to pick up, it doesn't mean you shouldn't pick the weight up. No, you should pick it up and appropriately use it. I don't recommend throwing it around or anything like that, but there's a way to challenge yourself that actually ends up strengthening you.
Yes.
And it sounds to me like that's a bit of what your experience was like.
Yes. He would, like I was saying, the tasks that he would give me to do, it wasn't to go out and mow the lawn. I mean, they were like, it was how you're dealing with a situation or how you're talking to somebody or writing in a journal or, whatever it was. And they did make me uncomfortable. I was afraid to do them. But I figured I'm not on an even keel here, but he is. So I'm going to trust him if he says, try this. It doesn't necessarily have to be successful, but I'm going to try it. If there had been anything that I thought was really like bad or worrisome, I don't think I would have done it. Mm-hmm. But everything was like, well, what I was doing wasn't working. So, maybe that's why I'm going to talk to somebody. If he doesn't know what he's talking about, I would probably know. I wasn't that, I know there's different mental illnesses. So I wasn't, I think at a very, I don't know how to say it without sounding bad, but I wasn't like totally feeling crazy. So I could make sense of what he was saying enough to say, yes, that's uncomfortable for me, but I can do it or I will do it. It wasn't like, I think you're trying to, manipulate me or.
So, would you say that there was a fair amount of trust that you came to the table with regard to this?
Yes, clinician? Because at the beginning, I told him everything and he asked me a couple of questions and he just let me talk. And the very first things he gave me to do were things that were not, it wasn't like, oh, that's weird. Why would you suggest such a thing? It was, oh, okay, that makes sense. And so I would try it, and it would work, or I would, whatever, I can't even think of the things he would tell me to do. But I would try it. And I thought, well, I felt much better after I did that. I'm going to keep doing that. And then he'd give me more and more. So I guess trust builds up over time.
Well, and it's interesting, I feel like a lot of times when people come in, they're so out of sorts with themselves that they don't know how to trust themselves.
Yes.
They've become very removed. And so that misalignment leads to all kinds of feelings of insecurity. And so it sounds to me like you really did cultivate a relationship with this therapist. And so let me ask it this way. The things and the directions and the suggestions that he was offering were extremely helpful to you. Was the creation of the relationship with him impactful as well?
Yes. In fact, the second time I went to see him, I knew I had to go see somebody the second time that I had this life event. And I wanted to go back and see him because I liked him so much. And I thought the things that he said were helpful to me. And we actually ended our therapy sessions because he was ill and he passed away. And then when he passed away, in fact, I could start crying thinking about it, but I remember hearing about it and I knew he was going to die. And when he did, it was like, oh.
Devastation.
Yes. Not because I really didn't need to keep going to see him. He just had sent out a letter to all his patients saying, if you need to continue your therapy, here's who you can go talk to.
Yeah.
And I had kind of been winding mine down, but it was weird to know he wasn't there. So then I thought, if I ever need therapy again, who am I going to go talk to? Because he wasn't there.
Yeah. Boy, that's tough. And it speaks to the level of a relationship that you had with him. I don't know if you saw this documentary by Jonah Hill, and it's on Netflix, and it's called Stutz. And it's the last name of his psychologist, I believe. And
but I know who he is.
It's very interesting. And as my husband and I were watching it, he was talking about like different techniques and I thought, yeah, I can get behind those techniques. But what was very salient to me and what I believe was very healing for Jonah Hill was the quality of the relationship that he actually had with Dr. Stutz. And it's truly fascinating to watch it, but it's very reflective, I think, of what feels to me like a lot of what you got from your time.
Well, yeah, if you're going to be spilling your guts to somebody and telling them, and you're completely vulnerable, because then you think, oh, are they judging me? I mean, even if that's their life work is to be a psychologist or psychiatrist, you still think, oh God, I'm going to leave here and they're going to be like, oh my God, she's far gone or something. I mean, you feel like you're going to get judged. And if you don't feel like that and you feel like, oh, I can go talk to this person, he didn't even have to say a lot sometimes. I did all the talking.
Yeah.
And, he'd nod his head. One time he fell asleep.
Oh my. Was maybe that during his illness? I don't know.
No, it could have been, but it was the second time around and we were very, very close, I thought.
Yeah.
And he knew me really well, and he was eating a bagel while we were in session, which he used to do because I used to go like at 10 o'clock in the morning.
Yeah.
And one time he got very sleepy and I said to the car, I guess I don't need to come see you anymore if you've fallen asleep.
Oh my gosh.
So there's nothing real worrisome here.
Wow.
Oh, I never was offended by it. I thought it was hilarious.
Well, bless your heart for not being offended.
It was very funny. I'm like, stop eating bagels.
Yeah. Well, the bagels make you crash like crazy.
Well, that's what I think he had the morning crash.
Yeah, totally.
But I will say, I took my son to a therapist several years back. He's 14 now, and he has ADHD. And we went to a therapist, and I did not like her, even for him. She wanted to meet with me and my husband, and then our son. And I will tell you, as soon as she started in with so how was your childhood, and started bringing up things in my childhood and my husband's childhood, that's where I was like, you know what, we're not doing this. I'm not going to start dredging up things about my son's grandparents and how I grew up, because that's not the issues that we seem to be having with him. So we did have a bad experience with the therapist. I said, this is not the direction that I feel like we need to take for my son.
And it sounds to me like you knew that very quickly within the session itself.
Yes.
When the questions started coming.
Yep.
There was a part of you that went, I'm not quite sure that this is the best fit.
Which is what I was talking about. When you go talk to somebody, I think sometimes you can just tell this is going to be fine. And then sometimes you like, this is not going to help me.
And what qualities, I mean, it's such an individualized thing because everybody's an individual. And so you're not meant to mesh with everyone, because then you'd be spread so thin, there wouldn't be enough of you to like pass around. Right. So that's one thing I always tell people. It's like, you're not supposed to mesh with everyone. And if you don't, that's okay. It just might not be the best fit. But what, from your perspective, Christine, do you think, at least for you, what qualities or traits did your therapist possess that made you feel pretty early on like this is a good fit?
He didn't do a lot of talking in the way that I think most people think about psychology or psychiatry, with the highfalutin words and stuff you guys probably learn in school and all of that. You know what it was more like, let's just talk. And, he wasn't. So how did that make you feel? That did not work for me. The kinds of things you see like on TV or something.
For sure.
That was not going to fly with me. And that was too like, I don't want to be bothered with all that. Can I just tell you what the problem is and you let me know what you think about it?
So would you say that he was very down to earth?
Yes.
And like a real person?
Yes.
With you, and that was extremely important to you, like in order for you to feel safe
Yeah.
that you had somebody who was also an actual human being. And the reason I ask is because this is now over 15 years ago when we were in a different office. It was decorated like this. This is a lot. I mean, I have this rug at my house, in my kitchen, and I like the earth tone colors. It just makes me feel good.
Mm-hmm.
And my husband was going to see a brand new patient, and she showed up and, with all of this decor, and she's like, this doesn't look like a doctor's office. I've got to get out of here. And she left. So, and for her, it just wasn't a good fit in terms of just the decor. So when we're talking about what's familiar and what's comfortable, those aspects I would imagine they're important.
They are.
So that you can feel like, I often tell people this is like my living room. And there's a reason why we have the scenery that we look out at. Well, we look out at, it's behind you. But my husband and I talked a little bit about what do we want in our new place. This was now 15 years ago because we didn't have any windows. It was a very small space. And my husband said, well, I really want big windows. I want to look out and see green. And I said, oh, I want water and I want a waterfall. And my husband actually laughed at that. And I was like, if you could just turn around and take a look behind you, there's a waterfall. Yeah, there's a waterfall. So to me, I mean, it's not on right now, but that rock structure back there.
Oh, yes.
That's a waterfall. In fact, they're probably going to be they should be turning it on any minute because it is May. And I think we're past snow in Chicago. I don't know. It's always a toss up.
But yeah, I hope so.
We're going to keep our fingers crossed. But yeah, that's a waterfall. So when I walked into this room and I saw what I saw, and there was the waterfall, and I told the real estate agent, give me 1 second. I just went next door. I said, yeah, we're taking it. Sight unseen for you, but we're taking it. And for me, that was so important that we had all of the elements that were important to us for us to feel good so that we could be plugged in enough and create the space for the people that sit opposite us, because it's a very intimate and trusting relationship. It's a very unique relationship. It's not, it's a little different than your circle of family and friends. Mm-hmm. And it's so helpful to me to have your opinion on what made it successful for you. And the final question I have for you, and this is a question I often ask people, varying degrees of this question, but what would the you of you today communicate or want the you of you starting therapy to know in terms of what you gleaned, what you learned, what mattered to you in terms of the aspects of therapy? Like, because you didn't know what to expect when you first started. So sort of through that lens, the you of you today, the you of you starting back then, what would you want that you of before to know?
That it was going to work.
That it was going to, be okay. It's going to be all right. This is going to work. You can count on this. Is that sort of the message?
It was that. And also you're going to get out of it what you put into it. I think a lot of people feel like they're going to go there to see somebody and they're going to tell them their story. And then that person is going to magically make it fix it. So if you go to a medical doctor and you say, something seems wrong with me, and they go, oh, your thyroid isn't working right. And they give you some medication and off you go, and you may change your diet and do whatever, but it's you're doing it. But it's clear to people that that's what I'm going to do. I'm going to take some medication. I'm going to check in with my doctor periodically. And then I'm going to go, walk and get some exercise and eat right. But I know I'm going to do that. But they want to go to a therapist, and I think they think, well, he's just going to tell me what to do, and then it's going to change everything for me. And it doesn't work that way. It doesn't work that quickly, I would say. For even my case, where I didn't have clinical depression, it didn't work that quickly. I went to see my doctor 2 times a week for quite a bit of time, and then I went down to once a week because I was just a mess.
You needed the support.
I did. I didn't know which end was up. I was so out of it. So, that's what I would tell myself is you're good. What you put into it is what you'll get out of it, and you will get better. It will help you. But, that's hard for people to hear and believe because they haven't experienced it yet. But I would say give it a try.
Right. And you don't know. I mean, words are so important. And there is nothing like personal experience that is sort of like your insurance policy that lets you know what?
Well, yeah.
This is going to be okay. And I would say that is amazing advice and so important for people who right now might be considering therapy, but might be a little bit afraid about it, might not understand it. But you've explained it so beautifully. And I so appreciate you taking the time to help educate other people and let them know that you'll get out of it what you put into it, that it may take some time, but showing up for yourself, there's just no better investment. And when you find somebody to be able to walk that path with you, then there are possibilities that you can.
How many people do you think don't go to therapy because of what they think other people will think about it?
No question. I think that that's a deterrent. It's this weird dichotomy, Christine, where there are some people now who use a therapist sort of like as a measure of success. It's like, oh, I've got to go see my therapist. And, it's sort of like a status symbol. But then there are other people who are like, oh God, people will think I'm crazy, And the truth of the matter is, if you're breathing and you've got, interactions with people, you're going to have issues. You're going to butt up against something that is going to challenge you. And even the Mayo Clinic says that if you have a coach, you're X number of times much more likely to be able to be successful in attaining whatever goal you're seeking. And what that is and what that offers is perspective. And when I talk to people about what I do, yes, I'm a doctor of clinical psychology. Yes, I'm a wellness coach certified by the Mayo Clinic, but I'm also a professional perspective shifter. That's really what I do. When you have somebody who, say, for instance, is struggling with depression, biochemically, they've got very dark colored glasses on. And they're meant to, when you're in a depression or you're in a fight or flight situation, you're not meant to consider all the options and feel really relaxed about it. It's like, get out of danger, make a decision, and we'll deal with, we're going to survive this. We'll deal with thriving much later. And so from my perspective, when people come in, they're wearing these glasses. And when you ask a particular question and they don't expect it and they really need to think about it and they shoot out an answer and then they go, oh my God, I really think that. I didn't know that. That's like the golden moment. Right. It really is, because so it's certainly using my level of expertise as being a Sherpa to help people be like, well, I don't know if you want to go down that road. This is the better route I would take. But ultimately that person is in the driver's seat. And when they realize something that they weren't necessarily conscious of, but they realize the truth of it, there's so much power. And that for me is the essence of helping people walk their paths through life, is help them reconnect to their power, help them remember who they are, help them navigate the challenge that's in front of them and grow into something more so that they can have the strength to hopefully thrive.
Yeah.
And it does sound like that's where you got to. And
I still have challenges day to day. I don't know that I need to go to talk to somebody, but I did learn things about how to keep myself calm and how to think about things and strategies and tools in my toolbox. That's what I tell my son the same thing. When you have tools at your disposal, start using them. Help yourself. So I have ways of coping, but I feel like it will always be an ongoing challenge. But I think he left me with, you can do these things yourself. I'm not like some magician. And I'm also not one of those people that's like, oh, I had to go see my therapist because I had this episode on Thursday. I mean, I think you have to learn how to take care of yourself too and help your own health. in some regard, and you can do that. So,
Well, and it is such a learning process. We never stop, right? Because
right.
we're moving through life,
Yes.
and life is coming at us, and we've acquired the tools to deal with it as we go. Sometimes we just need to acquire another tool.
Yeah.
And
I wouldn't hesitate to go back to see somebody if I felt like I really needed some direction.
How wonderful.
I mean, I tell people all the time, you go talk to somebody then. If you don't like what everybody else around you is saying,
mm-hmm.
and you don't feel safe telling them something, like it's too vulnerable for you, go talk to somebody, because their only investment is trying to get you better. I mean, they're not going to get anything else out of it.
Correct.
I mean, so go talk to somebody. And then if you don't like that person, it doesn't mean therapy didn't work for you. You go find someone else. It's just like your medical doctor. If you don't like them, you go somebody else.
Yes. And it's just what a wonderful thing it is when you feel the click.
Yes.
When you know, oh, you know what? I'm in the right place. I might not know exactly what the path is going to look like, but I know I'm in the right place. And I feel like there's sort of an intuitive.
I didn't even have to think about it. It wasn't something that popped in my head. I think you would think about that more if you know something doesn't feel right with that person. Like something.
That's a great
as
point.
Soon as I was there a couple times, I'm like, oh, well, of course I want to go back and talk to him, because, I like talking to him,
Mm-hmm.
tell him all this stuff.
Yeah.
So I didn't even think, oh, is this working? It just did.
Wow.
And then, like I said, with that therapist, my son saw, I knew right away. I'm like, this is not going to be, it's not going to be good.
Well, it's obviously it's so key that you have the right person and that they're a good match for you. Because then it's sort of, you're not that aware of, oh no, is this right? That hurdle has already been overcome. And now there's a receptivity to, I'm invested.
Yes.
I'm invested in this process.
Yes.
And that's where the magic can happen. And I find that being able to reflect back to the person sitting opposite me, what I've heard in terms of what's important to them, is also a key.
Oh, yeah.
Factor.
Yeah. If you're repeating something back and it doesn't sound right, then you'd be like, I didn't say that. Like, you're not getting it.
Right.
Yes. That would be, I think, an obvious sign that something's not gelling.
Yeah.
Yes. Makes a huge difference.
Well, you've really provided us so much wonderful information and so much insight. And
I hope so.
You really have, Christine, and I just so appreciate your time. This is such a beautiful way to, extend yourself in hopes that somebody else will find your words encouraging and will trust themselves enough to take that step. So,
I hope so.
Thank you.
You're welcome.
Thank you so much.
You're welcome.
So appreciate it.
You're welcome.